Is it possible to get pregnant while on birth control? Some studies indicate that it is technically possible to become pregnant while on birth control pills. Except for abstinence, there is still no 100% guaranteed fail-proof birth control medication or method. In using birth control pills, for example, one must take into account the need to constantly and consistently use the product as prescribed by a physician. It has been reported that there is a 1 in 1,000 chance that a woman on birth control pills would become pregnant. Merely missing a few doses of the drug already creates a high risk of pregnancy. The chances of getting pregnant while on birth control pills, if one does not follow the proper directions for use, would rise to around 5%, or 1 in 20. So how does improve the rates of effectiveness of contraception? Many women who do not wish to become pregnant may use a combination of birth control methods. Because the birth control pill offers no protection whatsoever from sexually transmitted diseases or STDs, many women choose to use some sort of barrier method, such as the male or female condom, birth control patches, the sponge, or the diaphragm along with their birth control pills. Put together, multiple methods of birth control make pregnancy much less likely, so the more methods used together, the less chances of getting pregnant. One concern that many women have regarding birth control pills is the risk that the pill might present to their baby if they do happen to become pregnant. However, the new generation of birth control pills have been specially formulated to reduce if not eliminate harmful effects on unborn babies or to a pregnant woman. Unlike the older products, these newer birth control pills no longer contain high levels of hormones which could possibly cause physical defects. Another concern that some women have in terms of birth control pills is the effect that they might have on a pregnancy test. Birth control pills usually contain estrogen and progesterone, which are hormones that control a woman's ovulation, which then reduces the chances of fertilization. Pregnancy tests measure human chorionic gonadotrophin, or HCG. HCG levels are not contained or elevated by taking birth control pills. In other words, taking birth control pills would not affect the results of one's pregnancy tests. But just to be sure and safe, a consultation with the physician or gynecologist is appropriate enough for this kind of situation. Still, if you have become pregnant while on birth control pills, you should stop taking them immediately and discuss this with your health care provider or attending physician. If preventing pregnancy is the top priority of a couple, then a combination of birth control methods can be a fairly effective approach when dealing with such. If still doubting, then abstinence will do the trick.